expert.
Oh, you are now then. You are now then. Okay, guys, all recording? Okay. Okay, firstly, tell me your name, please, and what you do.
Okay, first of all, I would like to thank you for giving me this wonderful opportunity to be with you here today. I'm Dr. Ashraf Amir. I'm a consultant in family medicine. I'm the Executive Director of Medical Services in the International Medical Center in Jeddah, Saudi Arabia.
Okay, so we have this World Awareness Day today. Just explain to me what it's all about and what you hope it will achieve.
Well, today we're talking about obesity, and as you know, obesity is one of the major health problems globally, in particular in Saudi Arabia and other parts of the Gulf areas. So it turns to be an epidemic rather than a clinical entity that we encounter. And you know, the prevalence become very high. Almost 25% of our people are overweight, and about 35% of our population in Saudi Arabia, they have body mass index more than 35. And this signifies that there is a huge problem that's coming on the way unless we curb the epidemic. And in fact, the impact of this problem on the complication of obesity is phenomenal and devastating at the same time. So there is a lot of complication on cardiovascular mortality and morbidities in terms of disease and complications, as well as a lot of incidence of witness in terms of cancer, depression, osteoarthritis, and so forth. And most of the obese, because of the obesity, they turn to be inactive people in the community. And because of inactivity, they turn up to have more complications. Ultimately, they become a bedridden and subject themselves to a lot of complications.
Isn't the problem that people just eating too much fast food, just not being healthy enough?
Well, this is part of the problem, is the lifestyle. The lifestyle is most of our people in the community, because of inactivities and improper dietary habits and a lot of stress, especially in those who are working a stressful job. As a part of all these factors, they turn up to be obese. And our role here is to change the mindset of our people in the community and to elevate awareness about the disease and to allocate all the resources. So it's not only the problem of the people to enhance their ability to understand and participate with us as an active participant in the management of obesity, but also to tackle the physician part who are reluctant to address obesity in daily practice as an important consultations that has to take place regardless of specialty. And then the other factor is the healthcare system. We have to modify our healthcare system to be capable of getting both physicians and patients into proper encounter, give them enough time, allocate all the resources, and eliminate all the obstacles that bring the patient into the proper management and give the patient the appropriate medications. And now we are witnessing a new era in the management of obesity, although we have multiple medications available, but unfortunately, it wasn't very successful because most of the time we have to integrate the lifestyle modifications, behavior modifications, psychosocial support, and the good medications. And now we are going to see in the market shortly a new medications, which is Saxenda, coming up with a new format that reduce the weight by single injection on daily basis, and ultimately this will be an added value, and new molecules will be given to us as a physician to be on the table to choose and to customize it as according to our patient need.
Okay, thank you. Yeah. Okay, all I would say is